Have you been told that you have high cholesterol and that you need to make dramatic changes in your life or else start statins? Or maybe they didn't even offer you for making dramatic changes in your life. Or perhaps you don't know about all the wonderful things cholesterol does do for your body and what statins can also do to your body. Uh, and by the way, there's a class action lawsuit on statins because it causes memory, cognitive decline, memory issues. Just that you know, so that you can say no one's ever told you about it. Now you know. Well, today in the classroom, we are very lucky that we have Dr. Thomas Levy. And when I say doctor, I mean MD and JD. And he looks at both sides of every equation because he can. And he's able to say whatever he wants to say because he can. And the reason why is because he would rather tell you the truth than us not know the truth. So today we're going to be learning about the truth of cholesterol and statins. So get your pencils and paper because we're going to learn and grow together.
And when you need a friend, you can count on me. I'll be right here waiting for you.
Hi, my name is Lillian McDermott, and I am a certified life coach, a certified holistic cancer coach, and the host of the Lillian McDermott radio show Classroom. If this is your first time in the classroom, please know I've been waiting for you. This is a safe place where you can go when you need a friend. It is my commitment to provide natural ways to heal, and it is my mission to make awareness, responsibility, and truth a part of our everyday life. And I hope you, my listening and viewing friend, will feel empowered to embrace a new truth and live the life of your dreams. Well, as you know, Dr. Thomas Levy has brought so much powerful information from hydrogen peroxide nebulization to doing the optimal treatment of diseases. He's helped us all learn how to use his protocols. He's also taught us about methylene blue, vitamin C, and the list is endless. And by the way, I've just started taking methylene blue and I've seen an incredible change in me already. And so today we're going to be talking about cholesterol and statins because a lot of people are in this world taking statins because they think that's their only choice. Well, if you think that's your only choice, think again. It's time to learn and grow together. And since it is our sole purpose in life to give and receive love and knowledge, I am grateful that Dr. Thomas Levy is here to do just that. Welcome back, Dr. Levy. It's always nice to catch up with you.
Hi, Lily. Always good to be here.
That's right. It is. I hope you always say that. So let's talk about some of the myths about cholesterol because there's a lot of myths out there. Because there was a time when I changed my diet and I went raw vegan. I know that this is not something that you would ever want to do, but I went raw vegan many, many years ago, and my cholesterol was 330, and I almost fell off my chair. But when the doctor looked at my cholesterol, they said that it was the most beautiful blend. So let's talk about cholesterol, some of the myths and some of the things that we need to know about it.
Well, generally speaking, cholesterol is simply an important building block for a lot of other molecules in your body. In the brain, as you alluded to earlier, because of the lawsuit on the statins, not having enough cholesterol and then having all the central nervous system problems. And something else about statins, they deplete coenzyme Q10, which is one of the most critical things you need in normal and even above normal levels inside your body and inside your heart. Now, the confusion, misconception on cholesterol comes from the fact that cholesterol does not cause atherosclerosis. Once you've started developing blockages, cholesterol, along with calcium and other fats, will accelerate the rate at which plaques and blockages grow. But it's important to realize they are not the initiating factor. The initiating factor is always a low-grade infection inside the coronary arterial wall. And this subsequently uses up, called chronic pathogen colonization, usually coming from the mouth because we have identified those bugs. So usually an oral cavity infection from the gums, teeth, or tonsils seeds the blood, and because the coronary artery is the first high pressure vessel to get the output from the left ventricle after it comes in from the left atrium, it gets embedded in the coronary arteries and it starts growing. And for those who might remember, the thing about vitamin C is needed to deal with oxidative stress. Infections have high oxidative stress. So as long as an infection is growing there, it's using up all the vitamin C. So what does that mean? When the vitamin C is used up, by definition, you have a state of inflammation in that artery. And the cardiologists even today say inflammation causes coronary artery disease, no question about it. But nobody wants to peel another layer off the onion and say, well, why the heck are we having an epidemic of inflammation? We're having it because of this chronic pathogen colonization. Now, what does that do? Once you have inflammation anywhere, low vitamin C level, you have an acute immune response. The immune response is completely dedicated to restoring normal levels of oxidation inside the blood vessels. So when your vitamin C level is low somewhere, the actual cells in the immune response contain high levels of vitamin C. The monocytes that come, they're actually delivery vehicles to bring in lots of vitamin C to restore a normal oxidative balance. But when the situation is chronic, in other words, you have an infection that's not going away, that never resolves the problem. The immune response only resolves inflammation when there's not something continuing to cause new inflammation. Now, that initiates atherosclerosis for one reason. Vitamin C is essential to building the structural molecules, the collagen that makes the blood vessel strong. Okay, obviously you want a blood vessel that's not going to rupture, especially in your heart. Well, when you have a severe depletion of the vitamin C, guess what? The vessel wall becomes very weak, mechanically weak. And it's natural for the body to try to give you compensatory mechanisms for whatever is threatening the integrity of the blood vessel. So the last thing your body wants is your blood vessel to balloon up and rupture. But if you don't have the vitamin C to make it strong, what's your next best option? And the next best option is to make the arterial wall thick. And by making it thick, you make plaque. So the purpose of the plaque and the growing there is to make the blood vessel wall thicker and much less prone to rupture because it's thicker. Obviously, when that continues unchecked, you eventually block the blood vessel off completely and have a heart attack. Now, cholesterol, once this situation gets going, as it turns out, also, in addition to being part of what evolves the atherosclerotic plaque, doesn't start it, but evolves it, is we have a whole host of literature, old literature, but very good literature, that shows the lower your cholesterol goes, the greater your chance of heart attack. Okay? Nobody seems to realize this, or nobody wants to look at the literature, but why is this? As it turns out, what did I say causes heart disease? I said infections in your mouth seeding the blood vessel. As it turns out, cholesterol is a natural neutralizer of toxins. It's a natural toxin neutralizer, and it raises in your blood as a response to try to neutralize the toxins that are coming from these infections being released in the mouth. So what happens then when you lower the cholesterol, especially way down, without addressing anything else? All you're doing is removing a natural defense mechanism that your body has in place to protect you from the toxins in the mouth. And so that's pretty much where we stand right now. It's and I got to add, for people this is brand new information, let me tell you what makes it so concrete. Is there was a study done in 2006 where they took 38 different patients who had known coronary artery disease, known blockages, and they wanted to scrape the plaque out. So they did angiograms, and they did something called atherectomy, which is basically like a roto-rooter. They went in and actually physically scraped out plaque to open up the blood vessels. And then they examined that plaque. They found inside that plaque over 50 different pathogens, mostly from the mouth, viruses, fungi, bacteria, all throughout all this plaque. Furthermore, they saw it in 38 out of 38 patients, which I like to say is pretty damn close to 100%. So there really is no other. If you have a heart attack and you have atherosclerosis and you examine the blood vessel wall post-mortem, okay, at autopsy, you're going to find these pathogens well over 95, 96% of the time. The only time you would find it would be under the rare circumstances where you have a site of infection somewhere else in the body other than the mouth. But it's still going to be the infection depleting the vitamin C, causing the immune system response, and when the immune response becomes chronic, what does the chronic immune response do? It brings in fibroblasts and other things to help build the plaque. So the acute immune response is protective, and a chronic immune response is degenerative. So, but anyway, and so now all this information has been around for many, many, many decades, 30, 40 years now.
And you're a cardiologist. You as a cardiologist, did you know this information when you practiced cardiology, when you practiced in your own clinic? Or is this something that you've learned since?
Yeah, I'm trying to remember. Probably pretty close to about the time I quit practicing cardiology to work with Dr. Hal Huggins, but I don't remember when it finally dawned on me. But it's a good question. I guess my mind is going. I can't put a date on it, but I know about 30 years now.
Yeah.
But yes, no, I practiced the cardiology along with the other, shall I humbly say, clueless people. Okay,
Yeah.
and I was
Yeah.
one of the clueless people along with them.
Yeah.
The only thing somebody can hope for, I think, realistically, is just to, whether you're clueless or not, is to not automatically reject anything that threatens your information scheme, so you can see if something new might be valuable.
So this is, I mean, shocking information, first of all. The idea that plaque is formed because it's trying to thicken the wall, brilliant. I mean, brilliant. It's the body is constantly trying to help us. And it's funny how we accuse the body of turning against us. Like with autoimmune condition, the body is actually trying to get rid of whatever is in our body. And then I hear people say, "Oh, my body is attacking me." No, it's not. It's trying to help you. There's obviously something in there that it's trying to get rid of, like maybe heavy metals or mold or something to that effect in that particular organ. And so when we look at when you're saying all this stuff, I'm thinking, gosh, this makes a lot of sense. Now, when you talk about vitamin C and the importance of vitamin C being in the body, which you know me, I take lots of vitamin C, but orally. Are you talking about oral vitamin C, intravenous vitamin C? Uh, what dosing can you suggest?
Well, everybody's going to be different on dosing because nearly everybody, not nearly everybody, very many people, and all of the ones that end up having heart disease are going to have these focal infections somewhere, and nearly all the time they're going to be in the mouth. And of the ones that are in the mouth, nearly all the time, it's going to be a root canal, okay, which harbors chronic infection 100% of the time. Now, bad gums can do it. Other teeth can become infected without root canals, and you can have chronically infected tonsils. But the point is for just about everybody, it's coming from the mouth. And that means, and especially with a root canal, we've talked about this in the past, but let me just tell people there does make a difference. I mean, I would never recommend a root canal because it keeps an infected tooth in your mouth, period, and in your body. But it does make a big difference how well the procedure is performed. They have a lot of dentists that just want to jump on the root canal bandwagon because it's a pretty quick, easy procedure, makes a lot of money. And the endodontists, who are the root canal specialists, hey, like anything, like any other mechanical anything, the more you do, the better you're at it. So the endodontists overall do much higher quality root canals. What I mean by quality, I mean the tooth is still infected, but the endodontist most of the time will seal it up a whole lot better, so you get less drainage of the infection, less bulk, less abscess, and less to disseminate in the body. I go into all that because you asked what type of vitamin C doses can you take. It depends. All right. If you have one root canal, but it's really well sealed, you'll probably do very well on a much lower dose of vitamin C than somebody that has 3 root canals, but they have nice little abscesses at the tips that every time you chew, it releases pathogens and toxins into the blood. Most people, then you have to decide. Obviously, it should be apparent that I'm telling people, if you want my opinion, get rid of those root canals, but have a biological dentist take it out, because you don't want to go from the frying pan into the fire. But with regard to dosing, if you're just going to put all that aside and say, well, let me just strike out and start supplementing, it's good if you have certain baseline blood tests. All right. It's very good to have, amongst other blood tests, for example, what's called a CRP, C-reactive protein, because that's a very sensitive index of inflammation. So anytime you have infection in your body, you have more inflammation. And if it's substantial infection, you'll appreciate this systemically by an elevation of the CRP. So I say, why that? Because you really only have 2 significant ways to decide how to dose your vitamin C. And one is how you feel.
Yeah.
And the
bowel
other
tolerance, are you talking about bowel tolerance?
Bowel tolerance, well, I mean, there are ways you can take vitamin C that don't cause bowel tolerance. I'm just saying a lot of people who have never taken vitamin C before in their life, and they start taking 2, 3, 4 grams or more, they have a sensation of wellness that they never felt before in their life. Okay. We all get used to the status quo. All right. If you've been low energy all your life, that's normal for you. That's what your normal is. I mean, it's like a colorblind person. How do you know you're not seeing red? How do you know your energy is low if you have nobody else but yourself to compare it to? But then when you start taking something that puts energy in every cell in your body, say, wow, I have a little clearer vision, clearer mind. I feel better. I just, and what that also does, Lily, is it gives you what I call a new health intuition. Because once you start taking vitamin C at whatever dose you decide on, I'm still not ready to tell you what's the absolute dose you should take, but at whatever dose you should decide upon, and then you feel this wonderful elevated state of wellness that you had before, then when you say get a new infectious challenge, or there's a little cold coming on, or you got exposed to something, you don't feel sick and you don't feel bad at first, but you no longer have that wonderful sense of perfection. So when you're dosing vitamin C or deciding how to take vitamin C, you had mentioned before about bowel tolerance. When you take a large amount of regular vitamin C with nothing else, it will cause eventually a loose diarrhea, not as a negative side effect, but just the fact that it's not getting absorbed, pulls water in. And it's actually good because you flush out a lot of toxins when you do that as well. But they make forms of vitamin C called liposome encapsulated. And when I say this, I need to clarify right away. I've been affiliated with a company for almost 20 years now, only because they really do it right. So if you want to try to get any old liposome vitamin C, well, you're on your own. But my recommendation is this form called Live On Labs. Now, what it does is it all gets absorbed. None of it gets down in the colon and really gets the vitamin C inside the cell. And that's what you want. You want delivery of the vitamin C inside the cell. And in many cases, just taking 1 or 2 grams of properly liposome encapsulated vitamin C is as good as taking 8, 9, 10, 11 grams of regular vitamin C.
Wow.
That's how substantial the difference is. Yes.
Wow. I've been taking their magnesium because
Excellent,
after we
yes.
did our class on magnesium, I'm like, okay, I need to I need to get some of this. And I've tried because as you know, Dr. Andrew Saul was a regular in the classroom as well. May he rest in peace. And basically, what he would say is take enough vitamin C to be symptom free or bowel tolerance, whatever the
Mhm.
case might be. And so he would say, bowel tolerance is gassiness, diarrhea, or loose stools. And that was what his little ditty was. Is that something that you would agree with?
Mostly, I would
Okay.
say, but mostly because it was 18 years ago when Live On Labs first contacted me. They knew I wrote about vitamin C. They thought I'd be a good representative for the country, for the company.
Yeah.
So they said, please try our product, see what you think. And I was in one ear and out the other. I said, okay, fine, send me some product. And I just took it and threw it in the closet. And then shortly thereafter, I got a big case of the flu.
Oh.
And I was sick as a dog. At that time, I didn't have a clinic that I could go to for my IV vitamin C because I'd already just gone and taken 50 grams IV.
Hmm.
I had already taken so much regular vitamin C that I had the really loose stools. I just couldn't take any more there. And I remembered one thing and one thing only. I didn't know what a liposome was, but they had told me, and I remembered this doesn't have a bowel effect. This doesn't cause any. So I said, well, maybe I can get some more vitamin C on board without upsetting my bowels further. So I went and I took 5 packets. I don't know why I said five, but I did five. And within an hour, I felt better than ever I had ever taken a 50-gram IV. And I said, what the devil is going on here? But the point being is, with regard to what my good friend and mentor, Dr. Saul, said, uh, I don't think he messed around much with liposome C, as liposome C does give you that additional option, even when you've reached bowel tolerance, to get the levels further inside your body without further aggravating that situation.
Interesting. Interesting. Okay, so let me go back to cholesterol again because there might be some myths or some truths that we don't know. One of the things that I've learned about cholesterol, and I do want to talk about good cholesterol and bad cholesterol and small particle cholesterol, whatever that is. Um, I was told that cholesterol drives our hormones, our sex hormones, our thyroid, and all that. Can you talk a little bit about that?
Well, only in general terms, and you pretty much talked upon it, which is is cholesterol is an important building block in many of those hormones. And I say most, in many of those hormones, cholesterol is a vital building block. And you were talking about the lawsuit against the statins. Cholesterol is really important in supporting the synthesis of many of the important molecules you need inside your brain. So, knocking cholesterol down arbitrarily, and they're really going crazy these days. I got to say that too. I mean,
I agree.
when these drugs first started coming out, um, they were usually knocking things down to 200, 210, 220 from high 200s or high 300s. All right. And they finally decided more is better, more is better, more is better. So they started going from 180, 150, 160. And now they have some, and I'll say the word, crazy doggone cardiologists that are taking people that already have a normal cholesterol of 200 and putting them on a statin and knock them down to 100. Now you're really invoking a lot of problems when you get cholesterol levels that low. You ever heard of the Pritikin diet? That was
Yes.
a doctor by the name, or a person by the name of Nathan Pritikin,
Hmm.
and he had I guess you could say, a phobia, an obsession with getting heart disease, and I think he came in with a very high 300 cholesterol, and so he decided he was going to cholesterol deprive himself as well as possible. He didn't have any statins to take, but he managed to be so um, completely vegetarian and exclusive in his diet that he actually managed to get his cholesterol down to close to 100. But the other part of the story that you don't hear is that he got leukemia and died. Now, remember
Really?
what I said at the outset here is the low, and this is very straight, very clear cut, very linear. The lower your cholesterol goes, or no, let me rephrase, the lower you push your cholesterol down, not if it goes down on its own. But if it goes down on its own, it means you're getting rid of your infections. That is responding to. But if you're using an agent to push it down, the lower it goes, the greater your chance of cancer. Clear and simple.
And what you're saying, heart attack too, because if
Sure,
it
and heart attack
eliminates
too.
CoQ10 in your body that's naturally produced, so that's because I know that I'm right now. So just to let you guys know, I've had a reactivation of Epstein-Barr, and who did I call? I called Dr. Thomas Levy. So I am on a combination of CoQ10 and riboflavin and um, um, oh gosh, methylene
Niacinamide.
blue. And what's the last one?
Niacinamide.
Yes, niacin. Well, I'm taking niacin. I take it at
Oh,
night.
okay.
And so when I'm flashing, I'm asleep. I have no idea. But anyway, I've noticed a change in me already. I'm sleeping better. And so there's so many things that we can take or all of a sudden we're trying to get our bodies, we want to reduce that infection that we forget that there are other things that our body needs that we may not be giving it with our regular food. So I really appreciate that. And let me tell you that you know how long I've resisted you with methylene blue. But once you told me there was a capsule I could take, I was good. But when you're thinking about this, now when I had my cholesterol at 330, I was eating a total raw vegan diet, and the doctor said, I've never seen cholesterol as good as this, the balance. So let's talk about the balance, the HDL and LDLs. How does that work?
I can't give you a sophisticated biochemical breakdown, but I can tell you that the statistics show pretty much you have what's called a high density lipoprotein cholesterol, HDL, and you have a low density lipoprotein cholesterol, LDL. And the statistical studies, again, I like to have more to go on the statistics, but that's all I have on right here. Is statistically speaking, the higher your LDL goes, the greater your chance of heart attack. And the higher your HDL goes, ironically enough, the more you're protected. Okay, this has to do with which form of cholesterol goes into the artery and stays there versus what form of cholesterol helps get the other cholesterol out. So that's an overview of the mechanism. It has to do with the ingress and egress of cholesterol as part of the building block for a plaque. But anyway, it also means, and I don't know why this is, but let's say you might have someone who, you might have a person, let's say, that has a cholesterol of 200, total cholesterol of 260. And 3/4 of it is LDL and 1/4 of it is an HDL. Well, that's not very good. Okay, that's a statistically high risk of heart problems. On the other hand, and again, I don't know why you have individuals like this, but generally they're in ladies. I've never seen this in men. You'll have a cholesterol, let's say, of 250, and half of it will be LDL, and the other half will be HDL. You have very high HDLs, and you have to get that total cholesterol out of your mind because the HDL is the good form, and the fact that much of your cholesterol is in the HDL form puts you at a much lower category and a much lower risk.
Very good. Very good. That's good to know because a lot of people see that total cholesterol and freak out. And a long time ago, I had a doctor who is a pharmacist. He's a PharmD, and he has a regular pharmacy, which he pulled me to his certificate, his diploma or whatever. It says he can distribute poison or something like that. It's like it's actually says that he can distribute it. And then on the other side, it was all compounding, natural. He had a lot of other things, and so he was the first one that told me, just because you have high cholesterol doesn't mean it's all bad. So we really need to be informed that the HDL, if your HDL is higher, that's the good combination. That's the
Right.
good. And he had never seen anything so good. At the time, I was feeling really well. Um, moving forward many years later, I would have to stop doing the raw vegan because it just wasn't supporting my body anymore. Do you believe that there comes a time in everybody's life that they need to reevaluate how they're eating, even if it's McDonald's?
And or they have to make a primary evaluation if they never made one before. Well, no, I
I'm
mean, our
poking
bodies
you in the
change, we
eye.
get older, our needs change. I mean, all of us need a healthy diet, obviously. Uh, Many of us are much less sensitive to shortcomings in our diets than others. But it's especially important what we're doing now with Kennedy and Maha is excellent. I mean, there's a lot of things that I could propose to Mr. Kennedy that could help in his quest. But it is very, very true that we have horribly polluted food. I mean, we have horribly polluted food.
Yeah.
And it shouldn't be, certainly for a society like we have, organically grown food shouldn't be limited to the very wealthy, which is what it sort of boils down to. I mean, if you have $5 to spend on a meal, you can't get $10 worth of organic meat and organic fruit and organic vegetables. It's that simple. But that doesn't mean that what you are buying is going to be pure nutrition. They have an enormous amount of toxins in our food, and we just saw something today where today and yesterday where already Steak and Shake, okay, has agreed, not has agreed. They listened to the information that Bobby Kennedy came forth with and realized that seed oils, one thing, but very important, seed oils were very detrimental in the cooking, and that using something much more natural like beef tallow was very good. And it's amazing when you consider the amount, a McDonald's person like myself, when you consider the amount of fast food that's consumed and the amount of French fries that are fried, an intervention like that can make a substantial difference. And of course, there's far more
You
things
think that
that
that's
can be
going to make
done.
a big difference? Because I'm sure the vegans are going to be very upset because, now they can't even have their French fries. That's going to be a
Well,
problem.
you're free to fire them in whatever you want. All right. And that Kennedy also emphasized that. He said, we're not forcing anything down anybody's throat. We just want to offer them education. And if they look at it and decide it's what they want to do, fine. If they want to choose something else, they can choose that. So we're not using any you're forced to do this for your good health.
Correct,
No,
correct.
nothing like that at all.
Yeah.
So and the other thing too is I need to make a point about vegans is when you're a vegan because you just feel very bad about eating anything of animal origin or this, that, or the other, that's fine and that's good and that's admirable if that's the type of feeling you have. But it's not the healthiest diet. So if you're eating vegan because you think it's the healthiest diet, I would humbly submit to you that you're mistaken. Now, meat eaters, for the most part, eat vastly too much meat. All right. Meat is difficult to digest correctly. And as it turns out, your best diet is a largely vegetarian diet with small amounts of meat in it. I mean, you have people that I'm not saying I'm not guilty too, people that want to eat a half pounder. They want to eat so many ounces
They
of
want
meat.
they want to get their name on the plaque on the wall because they ate 72 ounces of steak. Yeah, I know people like
but
that.
as it turns out, just supplementing something that's largely vegetarian with an ounce of meat at a meal or a meat related protein, because the greatest toxicity in any diet, Lily, comes not from the components, but from the fact that it's digested poorly.
Yes.
When you digest poorly, you get enormous toxicity as you get the overgrowth of bacteria in the gut, a leaky gut, and you start releasing toxins throughout your body, all primarily because one of the most significant but little known things about nutrition is the importance of food combining. Okay. When you combine the wrong foods and eat them at the same time, you doom yourself to poor digestion. And a large part of the food you take, because you slow down the GI tract, you slow things down, it goes from digestion to putrefaction. Just like you throw a piece of meat on the sidewalk and it starts to rot, but it won't rot for like 8 or 9 hours. Same thing with your gut. Put it inside your gut and it's not out within 10 hours. The extra time is going to be spent with putrefaction. And that's sort of how you measure it. You measure it because you should be having at least 1 and probably 2 bowel movements a day. All right. Anybody that goes a day without, you already got somebody highly toxic, because it should take
that is so important.
10 to 12 to 14 hours, no more.
Yeah.
All right. And when it goes slower, that's not digestion taking place, that's putrefaction.
Yes.
And then all the enormously important and horrible negative bugs. And this is, of course, one of the major reasons for so many gut problems that we have in society today. You go to the drugstores, you see aisles and aisles and aisles of gut therapies, constipation, heartburn, ulcers, the whole ball of wax.
Tums, we've talked about Tums.
No,
Let's
calcium,
not even talk about Tums. No calcium.
Problem is Tums work symptomatically. That's the real bad thing about it. If you have some heartburn, whoa, Tums or Rolaids will just cool it off in seconds, but you're taking a horrible dose of calcium in the process.
And please share really quickly what that will do, because we did a class on this, on calcium. And by the way, all of you can go check it out, because Dr. Levy has his own, Dr. Levy has his own podcast and or playlist and on at whenyouneedafriend.com, the YouTube channel. But you'll probably get like a little teaser. In that teaser in the description, you can click on it and it will take you to the BitChute, because many times we got deleted, didn't we? Didn't we, Dr. Levy?
Yes, indeed.
So share a little bit about the importance of that.
Well, in a nutshell, and of course I wrote an entire book on this, so this is just a nutshell. But in a nutshell, beyond a certain minimal daily intake, which is very important for your health, calcium becomes purely toxic. All right. And the more calcium you take, the more that gets inside your cell, the sicker every cell gets. I mean, there's not a sick cell in your body that doesn't have an elevated level of calcium in it. And it will never become normal until you find the ways to bring that calcium level down, which I'll also add, the most important thing to do to achieve that is magnesium. Okay, and that's probably that's the reason why magnesium is such a phenomenal supplement, is because it mitigates and decreases the impact of the single thing that's most toxic to your body, which is elevated levels of calcium. Now, having said that, I wrote a paper called The Toxic Nutrient Triad. And with this is calcium, iron, and copper. All right. My goodness, it upsets a lot of people that that think you should take these things. But the thing about nutrients in general, Lily, is you take a nutrient in and it does its thing, and then you have a natural excretion. A lot of it then goes out every day. So like vitamin C, it comes in and it goes out, comes in, goes out. Iron and copper are continuously recycled. You don't need any of them. And all you do when you supplement either one of those is you take this minimal level and increase it. And as it turns out, calcium, copper, and iron are your three things most important to natural cell death. The higher those levels get, the more you program that cell to eventually die. And infection provokes this, and other things provoke this, but just increasing those levels of those three things provokes it as well.
You know,
So
it's interesting. There are doctors that are still prescribing copper, and there are supplements that add iron or add calcium to it. I
mhm,
just noticed a supplement that I was taking. I was taking a extended release melatonin, and I noticed that it had calcium in it, and I'm like, I'm not taking this anymore. It had three little grams of or milligrams of it, but I said no, I'm not. I don't even remember if that's the amount, but. For some reason,
that's
the number
funny. I
three.
can't even think of a reason why you'd want to. I mean, some things, calcium is a natural part, and it's not a massive dose. It's a natural part of a certain type of agent, but I can't think of any reason why calcium should
No, I
have
was
anything to do with
stunned.
melatonin. Yeah.
I was stunned. I was stunned. And so I took it for the last time. I'm not going to take it until I find another substitute for melatonin. But it's one of the it's one of those brands that
Yeah.
you would think that they would know better, but they obviously don't. So let me just take a minute here because I do want to talk some more about statins as we go forward. But for now, I want to remind you all that the way that we start taking ownership of our life is by stopping right here in you, within you. This information is so powerful. And you know, there was a time where I thought it's what you eat. But if that were true, then there would be one population of people that never get cancer, never get heart disease, never get all. There's just so many different things that we don't know, we don't know. So I want to encourage all of you to go to whenyouneedafriend.com and start this journey with me. You know, continue this journey with me, whether you're at the beginning of the journey or you know
Well,
more than I do. I just want you to continue to go to whenyouneedafriend.com and take your health back. And so with that, go to whenyouneedafriend.com and subscribe to the channel. Check out my social media, subscribe there, especially the BitChute account, because I heard that Facebook is now going to take out all my videos that are longer than a month. So I think that the only place that we are going to be able to go to is BitChute or my website. Go to whenyouneedafriend.com and make sure that you become a subscriber. Share this video with everybody else as well. So there's so many different ways that you can help support the classroom. One of them is support all the sponsors of the classroom. Support Dr. Levy the way he's supporting the classroom as well. And, you know, and then also there's the Shop Now bag from head to toe. These are all Lilly approved products, whether it's from head to back pain for whatever it is. Some of them may be an affiliate and may provide a little bit of income, but just a little bit amount, but at least you're helping grow the show, and you know that it's an approved product that I do love. And then we also have events. We have a new event coming up. It's called Rewiring the Brain with Neurofeedback Training 2.0, and that is April 29th. So get your seat before the 19th, because once the 19th comes, the price will go up $20. So $20 more. So just check it out and get your seat in that particular webinar. It's worldwide. So whether you can be a part of it or not, if you pay for it, you'll get a copy of it, and regardless of whether you can attend. And last but not least, you can become an enrolled student in the classroom, and whether it's $1 or $1,000 a month, a one-time donation, whatever the case might be, all of it is so greatly appreciated. Like I said, sharing this video with your friends is a way to help grow the classroom, because once you have all these algorithms of comments and whatever it is, if you have any questions for Dr. Levy, you can write the question down. I'll send it to him, or you can reach out to him directly. I believe that that's something you can do as well. And so today I'm so grateful for Dr. Thomas Levy. I really learned so much from you, Dr. Levy. Even though I've been resistant with some of the things that you share, you eventually have me at hello. And so I want to mention that Dr. Levy, you can find him at tomlevymd.com. That is his new website, tomlevymd.com. If you are a subscriber of the classroom, then you already have his link in the blog. So just click on it. It'll take you straight to his website. Now, Dr. Levy, I know you wanted to say something when I was talking about that. To me, there's no one size fit all. What did you want to say about that?
Oh no, you're talking about having
Nutrition.
nutrition in your diet, and I said it's just as important to have a diet that has what you need in it, but
Yeah,
also you need to be aware of the stuff that's not in it so you can properly supplement.
that's right. That's right.
Because really, sadly, there's so many people out there, and I kind of know where their heart and their head is. They just want to believe, and I say believe because it's not based on science. They just want to believe that a perfect diet is all you need. A perfect diet, perfectly digested, is all that you need. And that's just not the case. As we've talked about in the past, nobody has enough vitamin C because we should be making it. Nobody has enough magnesium. Nobody has enough vitamin D. Those three things right there alone. That, I'm not saying they're the only important supplements, but I'm saying that's a situation where I don't care who you are or how rich you are or how wonderful in quality and organic diet you eat, you will never anymore in this stew pot we have of toxins that we live in, you will simply never take in enough magnesium in any diet. And you'll definitely never take in enough vitamin C because we should be making it and we lost that ability. And quite bizarrely, we don't get enough vitamin D, which, yes, vitamin D is good from sun exposure and everything, but the levels that we have determined by a great deal of research to be healthiest for you in suppressing cancer, dealing with infections, all the good qualities of vitamin D we know to be true, you simply have to supplement it in order to get it into the 50 to 60 to 100 nanogram per cc range. That's the one supplement where you do need at some point in time to verify that you're in the blood level that you need to be.
And what is the blood? How do you test it?
Just the vitamin D blood level. Yeah.
Okay, so is it the serum?
I don't know if it's called serum or plasma, just blood level. They'll
Okay,
do what they do.
okay, I'm trying to remember. I just recently did it. And one of the things that is not commonly known that when somebody has a reactivation of Epstein-Barr in the body, the body doesn't absorb the nutrients that it needs. And I've been taking 5,000 IUs of vitamin D every day, and my vitamin D levels keep plummeting. And so just recently, following your advice, I've increased it to 10,000 until I can get this,
Right.
the virus in remission, so that I can continue to, you know,
And you may find that the other four supplements are going to help that too.
yes, I mean, I'm already feeling
Right.
yesterday was interesting because I went to the gym, and I don't know if it was when I took the methylene blue, then I went to the gym. I don't know if there was something, but I went to the gym. I've been walking and being gentle with my body and all of that, just not aggressive lifting weights or anything like that. But yesterday was the first time that I had gone to the gym in a while, and when I say a while, maybe a week, because I was doing other things, and I just became really exhausted. And I just said to Robert, I'm like, I am just really tired right now. Maybe my body just needs to chill a bit, and just do some walking and some more gentle stretching. And I just need to love my body. I want to be an example of what I preach. I don't want to, because I know a lot of people that are wonderful healers, but then die of an early age because they didn't take care of themselves. So I want to
Sure.
make sure I practice what I preach. So I really do appreciate all the Dr. Levy-isms that I've been taking in. So let's talk about statins and why that should be the last step we take when it comes to lowering our cholesterol.
The only time, personally, uh, that I would consider it appropriate to prescribe a statin
Okay.
And even then, if I did prescribe it, I would make sure at the same time they were taking large amounts of coenzyme Q10, which is good for you anyway, as you know, but especially important if you're actively depleting it with the statins. The only time I would consider advising a statin is when I have a patient that has coronary artery disease, and I know for a fact that they have a large amount of dental toxins, dental infections, that they have no intention at all of addressing. So they've got the infection there, it's going to stay there. And then, and only then, would I take a statin for an astronomical level of calcium. In other words, as I said before, very high levels of cholesterol will accelerate the degree with which you evolve plaques. So if, let's say an example, somebody is 300, especially if it's the wrong balance of cholesterol, like we talked.
So we're talking to LDL. Their LDL is higher than the
It's-
HDL. Okay.
Right. So if you have a high cholesterol in the range of 300, I would say take a statin to try to bring it down to 240, 230, 220. So we're doing a balance. We're going to slow the rate of atherosclerosis evolution without giving you too serious a depletion of cholesterol and making you excessively prone to the other diseases caused by the toxins in the mouth. Remember what I said, because the less cholesterol goes up as your toxin levels goes up, because it's a natural antitoxin.
Okay. Now, you've already alluded to nutrition. You said primarily eat a vegetarian diet with a small amount of animal products. That to me is a nutritarian lifestyle. That's what Dr. Joel Fuhrman, where you primarily have, you get your nutrients from whole food, plant-based. But if you don't want to be a vegan and you want to have animal products, to eat between 5 and 10%. Do you think that would be, I mean, today people are eating 75%, so anything, much lower, like maybe 20% would even be better.
The lower amount, I'm reluctant to put an absolute percentage on it. The other important thing to remember about a vegetarian diet or a high vegetarian diet is most of the time you're going to stumble into a good food combination. So vegetarian diets combine much better and give you a higher quality of digestion. And I told you before that having poor digestion is much worse than having poorly constituted, poor constituents in your diet.
Yeah.
So having any substantial amount of vegetarian in your diet, things tend to combine better. I mean, it's beyond what we're talking about here, but unfortunately, what's the classic meal around the world? Hamburger and French fries. So you have meat with 2 different forms of carbohydrate, which is a horrible.
I was gonna say that.
Okay.
I mean,
but having you have sugar, protein, and fat, and generally the sugar goes with the protein goes with the fat, but the sugar doesn't go with the carbohydrate doesn't go with the protein. So I mean, and that was some work done many years ago by Dr. Ivan Pavlov. I'll just tell you really quickly. He found that when you put meat in the stomach, it takes 3 hours to digest and go out. Bread and pasta, 1 hour. And when you put the 2 of them together, it takes 8 to 9 hours.
Yeah.
So I can't tell you physiologically why that occurs, except that, what did I say is the most important thing? Keep the gut moving. You got to keep the gut moving. If you slow the gut down, toxicity skyrockets.
Yeah, Dr. Lee Cowden said that if you eat your protein first, your vegetable second, and your carb third, that's how it works. But I'm thinking once I chew it, it's all going to be combined. I mean, I don't know how that works, but
I would say just the opposite. I mean, you want to take the thing that leaves the stomach quickest first. And in fact, in Latin America, lots of people there, they have nothing for breakfast except fruit. All right, comes in, goes out really quickly. If you have a problem with your gut, you need to go to mono eating. I mean, you can eat all the different things, but just eat one at a certain sitting.
Mhm.
I'm not advising people go straight to that, but I'm saying if you really have had problems with your digestion and you're doing everything you can to normalize it and get it better, eat one thing at a time. Fruit in the morning, protein at lunch, and then maybe a salad for dinner. In whatever amount you want, but you eat them separately, and the digestion will improve enormously.
Well, I think this information is so important because we've been told that high cholesterol is really bad. We've been told that, in order for us to not get a heart attack or cancer, you need to have a lower cholesterol, and that's not truth. And so I'm just grateful that you've shared these truths with us. So let's wrap up. So if you were to say in less than 30 seconds what you'd want, if somebody's tuning in right now, and this is the only thing they hear before they go back and listen to something else, what would you say about cholesterol and the importance of cholesterol and statins?
Well, you got to go back to what's causing it. So, as we talked about before, you need to see a biological dentist and get a cone beam computed exam of your mouth, 3D X-ray, properly identify all infected teeth, and get those infected teeth extracted. I'm sorry, I didn't create the physiology or the pathology, but if you keep infected teeth in your mouth, even though, and I'm not talking just root canals, you have infected teeth that feel perfectly fine, and you have no idea that they're there until you look for it. So once the dental is taken care of, a lot of the other stuff will take care of itself then with good supplementation and following good food combining principles on your diet.
Very good. Well, thank you so much, Dr. Levy. It's always a pleasure to have you come in. And once again, Dr. Levy's website is tomlevymd.com. And you can, if you have any questions or comments in wherever you're watching us today, just write it down. Let me know, and I will send it to Dr. Levy, or you can send it to, where can some people get a hold of you, Dr. Levy? I know you're pretty
Like I
busy.
said, I don't do consults, but if people have questions, I can lead them to information sources just by email.
Yes.
My email.
Okay. And so for those of you, just write your questions down, make your comments, and that will help the algorithms keep this information for a while. Not that now Facebook is going to delete us, but in about 30 days, but at least get your information, check out BitChute, become a subscriber there. Thank you, Dr. Levy, for everything that you do, and I'm looking forward to our next conversation. We're probably going to be talking about more methylene blue and niacin and all of that coming up, because that's the combination you have me on right now, and I'm looking forward to seeing the outcome soon. And please remember, we'll be right here waiting for you worldwide at whenyounneedafriend.com. This is Lillian McDermott and Dr. Thomas Levy, MD, JD, wishing you love, peace, joy, and unexpected abundance. Make it the best day ever. Good job. Good job.
The opinions and advice expressed on the Lillian McDermott radio show are intended for the individual callers and guests on the program and are presented to our wider audience solely for general educational purposes. Please act responsibly and consult personally with your own medical, psychological, or nutritional expert before taking any steps to improve your life.